All right. Good evening, everyone, and welcome to the 2021 celebration of the Public Citizens for Children and Youth. I am Javier Suarez, and I have the honor of serving on the PCCY board, as well as its incoming secretary of the board. I am also co-chair of the PCCY Young Professionals Advisory Committee, and as a member of the events committee for the board, I have had the honor of helping this great event come together tonight. Thanks everyone for coming to our virtual event. We are so thrilled that more than 200 folks are here with us tonight. It shows the strength and the support that we have, that so many of you are here with us tonight, despite our collective Zoom fatigue. Because of the partnership that PCCY and Independence Blue Cross has had since way back in the early 1990s, millions of children are covered by CHIP today. Many people played a role in creating the CHIP program, and crucial among them, PCCY and Independence Blue Cross. So it's so great to be able to celebrate that partnership tonight. Thanks, Dan, Greg, and Independence Blue Cross for being here tonight as our honoree. And now I would like to thank our major sponsors by name. They are Independence Blue Cross, AmeriHealth Caritas, Bryan Communications, Children's Hospital of Philadelphia, Comcast NBC Universal, Diversified Search, McGuire Foundation, Morgan Lewis and Bacchius, PICO, PNC, the Philadelphia Foundation, Tandem Health, and Wells Fargo. Dozens of other companies and individuals have sponsored tonight's event. I encourage all of you to take a look at the virtual program that was sent to you earlier today, and please take note of the support that these fine organizations and individuals have given to PCCY and to so many that PCCY serves. Over the last 13 months, we have all endured a great deal. So, focusing on the health care of children makes perfect sense. Our children are better off because we have Medicaid and CHIP. Both programs have helped to keep our kids healthy throughout the pandemic. But we still have much to do. And that includes making sure every child, including those who remain undocumented, are able to get insured. Thanks to the many leaders in Pennsylvania, millions of our children are thriving. Thank you again for all of you for being here tonight and for your support. And now let me pass things over to our MC for the night, Miss Lorraine Ballard Morrow.
Thank you, Javier. It's such a pleasure to be here. iHeartMedia is proud to be a media sponsor to help amplify the work of PCCY. I can't think of anywhere I'd rather be tonight than here with you, the supporters of PCCY. There's nothing good that happens at scale for kids in the city and even across the state that PCCY hasn't had a hand in making happen. The work is critical. And as former Executive Director Shelley Yanoff said, and I think we all agree, I believe strongly that all kids are our kids. PCCY is the best example of the little engine that could. PCCY sees the challenges that children face, create the coalitions needed to solve them, and like no other group are undefeated and undeterred. Tonight, we want to take you back a few years to hear how the biggest policy change for children in the last 70 years happened. Here are the highlights for creating the Children's Health Insurance Program.
Being a Democrat, I was very hopeful that he would read my letter. So I was just hoping and praying that somebody would listen.
Mrs. Johnson wrote me last October about the pain that her family was suffering. Listen to what she said. And I quote in part, "We are literally going bankrupt, trying to meet our regular household expenses and pay this high premium.
This is truly making me sick. I feel I am throwing hard-earned money away to health care companies
That is getting rich on millions like myself that need money to have a home,
savings account and a little money to set aside to educate their children. Not only does this financial burden take every last cent we have, it also puts a tremendous stress on our marriage and family life. I have actually considered a legal separation
just to put myself and my children on a welfare medical card.
There were so many mothers in particular who were afraid to let their kids play sports, or afraid to let their kids just play like any other kid because what might happen to them.
A small group of citizens, advocates, and bold lawmakers made it their business to put children first.
And healthcare for kids, how could anybody oppose it? When you put it in front of them and don't say it's going to cost $5 trillion, you're going to make that kid able to go to school, that kid able to work, that kid's family able to stop worrying all the time.
They built a movement to pass the most consequential policy to improve the lives of children in 70 years.
We had to break this perception for the lawmakers so that when they met families in their own district that really were trying to access the programs, had done all the right things and still weren't able to get through the door, it began to convince them that there really was an issue, that they needed to get behind it, and that if they got behind it and devoted resources to it, that families would make use of them.
On December 2nd, 1992, the Pennsylvania Children Health Insurance Program was enacted.
Governor Casey was very proud to have Pennsylvania be one of the first states to pass a major children's health insurance program because he knew that that program could transform the lives of not just thousands of children, and not just tens of thousands, but hundreds of thousands of children.
Yeah, so I got enrolled in CHIP mid to late 90s. My mother, who throughout my whole life had been employed, lost her job. And because of her losing her job, we lost health care. But, you know, I have bad asthma and have had bad asthma throughout my whole life. So health care was extremely important to me and to my family. At the time, I didn't know it was CHIP. I just knew that I could go to the doctor.
The voice of parents desperate to ensure their kids was powerful, but advocates for children were there to carry the banner.
We advocated, lobbied, we did a lot of publicity. One of the things that we were able to do through the Child Health Watch was to identify families that would verify. So if we were identifying issues to legislators that families were experiencing, we could provide them with a family from their own district that would talk to them about how they had had that experience. And I think that was pretty powerful for folks.
It happened at a time when I think everybody who was working on public health issues in the community and people were really focused on maternal and child health issues had this idea that we weren't going to push things forward unless we raised our voices and started to do things differently.
And I was all about, let's just do it for the kids, and pretty excited about that. So I said, I was gung-ho on this. And so it really felt like just a great moment.
Pennsylvania paved the way for the nation. 4 years after enactment, CHIP became the model for President Clinton and was replicated across the country.
I think we didn't realize how trend-setting it was until we got it done. And then we realized that nobody else had done anything like this. And it was, 4 or 5 years later when the Clinton administration does S-CHIP, and it's like, that's our idea. We seeded this. And, all too often in Pennsylvania politics, we were followed behind what other states were doing. This was one where we really led the way. We accomplished something that became a signature program for the rest of the country. And that just made you feel really good.
A lasting impact on the lives of kids created a positive ripple that continues today.
I love signing children up for CHIP because it just gives you that sense of appreciation, something, and you're actually doing something for someone. People really need health insurance for their children, and if I'm able to help them, it just makes you feel great.
People would come up to me, and it could be, a town hall meeting at the state senate. I'm talking to someone, and someone would come up later and say, my husband was unemployed last year, and we would We struggled around health insurance, and getting CHIP was just a lifesaver.
Knowing that CHIP is out there and available, it's great. It's giving them other options. Sometimes health insurance on your job may be too costly. So if you know there's another option, it's just giving parents a little bit more of hope.
30 years later, parents can watch their kids enjoy childhood without anxiety about the cost of a doctor's visit.
I feel at ease, at mind, that I know that he's going to be covered and I don't have to worry about anything that I'm not aware of that can come about. Having health care that's going to cover at any time, any moment, any day is very beneficial for me.
Today, nearly 10 million children a year can go to the doctor when they're sick and get the medications that they need to keep them healthy, thanks to CHIP.
I think we all recognized that it was a program that would last for a long time. You know, quietly we would say to each other, once this gets going, there's no way anybody's going to stop it.
From Fred DeBona on down to young guys like me who were part of this, there was a general sense of we're on to something really special here. We knew the impact that we would have with this program, and we were truly dedicated to the cause.
And as a senator, I've been privileged to have had the opportunity on multiple occasions to vote to reauthorize the CHIP program nationally. I believe the CHIP is one of the 2 or 3 best Pennsylvania programs in my lifetime.
As much as we're worried about where we're going to come out at the end of the pandemic, I think we were much farther along than we would have been, without this access.
It's important to get the message out that we can show how well government can work when it listens to people at home and does the right thing. And that's what gives me more of a sense of reward, even greater now.
Bringing it to people's consciousness. I mean, we put blinders on so that we don't see things that are painful to us. But we got to take the blinders off and say, we can do better than this. And that's what CHIP did.
You can't get things unless you ask for them and unless you're willing to do the work. And of course, that's such a prime mission for PCCY to be able to act in that manner, and it's such a gift of that organization and that organization with all the different partners in the community.
I don't want to be over dramatic, but you never know. Having CHIP could have possibly saved my life as I had to deal with asthma growing up in Philadelphia.
CHIP was just the beginning. From healthcare to education to opportunity, there is so much we can do together. And it can start with a single letter.
We could not have a party to celebrate CHIP, honor Dan, Greg, and IBC without Senator Bob Casey. Of course, the senator needs no introduction, but Donna Cooper, PCCY's executive director, reminded me that way back in the late 1990s, when Senator Casey was the state auditor general, he used that obscure office to make the case that families need affordable childcare, and he's not stopped since then. In the U.S. Senate, not a year goes by when Senator Casey isn't asking his colleagues to sign on to his legislation to make the lives of kids better by improving their health care, child care, pre-K, and public schools. Last year, the senator released an inspired new call for a 5 Freedoms plan that would change the lives of children forever. It's clear the senator's proposals have penetrated the new administration as the bedrock principles in the Biden American Family Plan, which sounds very much like his priorities for years. Pennsylvania's own U.S. Senate champion for children, the Honorable Robert Casey Jr.
Well, Lorraine, thank you very much for your introduction. I'm standing in a library in Beaver County, Pennsylvania. Way out in western Pennsylvania, I've got a mask on because we're inside, but I'll just talk to you for a few moments without the mask. I just happen to be in a room that, as you can see behind me, has a lot of children's books. So I wanted to have the right background for this presentation while we're on the road. But I'm so grateful for this opportunity. As I was watching that video, so many memories come to mind. I hadn't seen that video footage of my father giving that speech and reading that letter, and I had forgotten, frankly, that that's where it started. I was really grateful to be able to see that again. And I think it's a testament. That video is a testament that one letter, one person, and in some cases one movement can make all the difference in the world, not just to help a child, but to transform the lives of so many children. We saw that with the CHIP program, as you outlined in the video, and as the evidence indicates. But there's more we need to do nationally that I think that has equal weight when it comes to transforming the lives of children. Not just nibbling around the edges, not just adding a little money here and there, but focusing on transformative change. And I think that's been the hallmark of the work of PCCY all these years. So I want to thank PCCY for this opportunity, and I want to thank you, Lorraine, and I know Donna Cooper's out there somewhere. Wanted to say hello to Donna, and to your two public citizens of the year, Dan Hilferty and Greg Deavens. I want to commend and salute Dan and Greg and the IBC team. And Representative Jordan Harris, I didn't know a lot of his story until watching that video. I've known Jordan for a number of years, but I didn't know the beginning of his story. Just wanted to make a few comments on the inspiration that CHIP provides for us today, because we'll still have some battles on CHIP and on Medicaid and so much else. And I'm always ready for a battle, a good fight. But I hope we can come together more on these issues, especially when it comes to helping children. Just think about what happened recently. The United States Congress sent a bill to the President of the United States, the American Rescue Plan legislation, that in one bill will have the effect of reducing child poverty by 1/2 in just that one bill. But we're not done yet. We've got a lot more we've got to do for children. We've got to extend the child tax credit, extend the earned income tax credit that helps so many low-income families, and extend the child independent care tax credit that helps families pay for child care. But just consider the child tax credit, just one policy in that rescue plan. That policy alone, by making that tax credit more generous, means that 90% of Pennsylvania's children will benefit. Millions of children just in our state, tens of millions all across the country. So whether it's child care or the child tax credit or food assistance or children's health insurance itself, we have to do everything we can when we have this moment to make these investments. These aren't costs. These aren't appropriations. These are investments in the life of a child, in the life of his or her family. And frankly, they're investments in our economy. You can't talk about outcompeting countries around the world or raising our GDP or growing the economy or having the best trained workers in the world. You can't talk about any of that unless you're willing to vote for investments in our children. And that's what the CHIP program was. The vision that started with one letter and then was the consensus was developed in one state capital, led by a governor, led by great legislative leaders, as you saw, made it possible for children to this day to have peace, have their families would have peace of mind. The knowledge that your child is covered, the knowledge that your child can get health care, preventative care, all of the benefits that come with the Children's Health Insurance Program. So we're just beginning in this fight to do everything we can to lift up the lives of children and to lift up their families. So thanks for the work that PCCY has done for more than one generation now. And I know that you've joined us in this effort to invest in our families and help our kids. But God bless your work, and I'm honored to be part of this program.
Thank you, Senator, for being a hero for our kids. And now, it's my pleasure to introduce a public school graduate from Bartram High School, now pursuing his doctorate in education. The former director of the Philadelphia Youth Commission, by the way, another PCCY win, was the charter change that created that youth commission. A trustee of Millersville University, the youngest state legislator, ever to be elected to leadership, the Democratic whip, who recently was the chair of the House Black Caucus, and a real champion for kids, and former Chip Kid himself, the Honorable Jordan Harris.
Good evening, and thank you so much, Lorraine, for that amazing introduction. And to all of my friends at PCCY, thank you so much for having me and including me in this event. As you now know, I was a Chip Kid. At that time, I didn't know what it meant or what it was. I just knew that when I would go to the doctor, or first of all, that I was able to go to the doctor, but that when I went, I was able to be seen. And when I needed my inhalers because of asthma, I was able to get them. You know, those are the kind of programs that are, as Senator Casey talked about, transformational. CHIP was transformational for me and for thousands of kids across Pennsylvania and now millions across the United States. So I'm honored to be here tonight to celebrate CHIP and also to celebrate my friends over at IBX, Dan and Greg, but also to challenge us to look for the next transformational thing. You know, when government and the private sector work together, they can create transformational change that not just affects this generation, but affects the generation to come. Transformational change like healthcare, transformational change like fully funding our public education system, transformational change like doing the right thing with criminal justice and reimagining what justice could look like in our Commonwealth. Those are the things that can happen when government and private business partner together to make real impact and change in people's lives. So tonight we celebrate legends, champions who have helped make transformational change. But we also challenge all of us to look for the next thing that we could collectively do together to bring transformational change in our young people's lives. They are not just our future, but they are our most precious investment. Thank you to PCCY and to all of you for the work that you do to help us make transformational change for our young people, for their parents, but more importantly, for our collective future. Thanks so much for having me.
Thank you so much. Good evening. My name is John Summers. I'm the president of this great board of directors of the extraordinary organization PCCY. Let me add my gratitude to everyone for being here tonight, but a special thank you to Representative Harris and to Senator Casey. Thank you very much for those remarks. Tonight, we're here to celebrate our 40th anniversary, but more importantly, to honor the work of the extraordinary contributions of IBC, as well as the work of PCCY that they did together to create the now National Children's Health Insurance Program. We did not do this alone. We had partners at the Maternity Care Coalition, the Pennsylvania Health Law Project, Community Legal Services, and so many others. And of course, we must call out the inspired risk that Fred DeBona and the IBC team took. First, there was the creation of the Caring Foundation to make sure that kids had access to affordable health care. Then Fred and IBC reached out to the city, and they in turn reached out to PCCY. Together, we all became partners in creating a novel new model of children's health insurance for working class families. Today, we simply call it CHIP. For those of you who are lucky enough to receive cookies, as I did earlier today, that we sent out in the mail, this is the moment in the party where it's time to make a toast. To make a toast this evening, we'll take the first bite out of those delicious cookies filled with chocolate chips. So with gratitude to IBC, here's to you. When Chip was being cooked up, Dan was running the Medicaid program for IBC at a place called Mercy. Now he's been at the helm of IBC for more than a decade, where he's dedicated himself to improving healthcare access, including making IBC's CHIP program the very best in the nation. Dan Hilferty's often said that his childhood, living year-round down the shore, was wonderful but not without struggle. He points to the hardships his mother faced making ends meet as a big reason that he's looked for every opportunity to help others throughout his career. Just last year, Dan orchestrated an impressive partnership with Project Home to increase healthcare access in North Philadelphia, where the poverty rate is a staggering 45%. In announcing that partnership, Dan said, quote, "We as a business community, we as a government community, we as an employer community have a responsibility to step up." Dan, we could not agree with you more, and we want to thank you for expanding the impact of Project Home's work in that community. What a difference you're making for those children who carry such a heavy burden. The same can-do and must-do spirit led Dan to become a national force in combating the opioid crisis, where he has deployed his time, influence, corporate resources to find solutions and to rally public policy to save millions of lives of folks struggling with addiction. I thought it would be apt to reflect on how Dan thinks, because I think it's a window into the characteristic that accounts for his success, and it's a trait that we at PCCY share. Dan is at heart an undaunted optimist. When we had to postpone our party last year, what did Dan say to our supporters? Quote, "One of the silver linings of this pandemic is that we get to celebrate the 40th anniversary of PCCY for the whole year." What an imagination. Dan, now a year later, sadly, not in person, we are ready to celebrate. Thank you for your leadership and contribution to the civic community life of our great city, of our region, and most of all, thank you for all you and IBC have done for our children. So please, join me in bringing Dan to our virtual program, and let's hear some remarks.
John, thank you for that warm introduction, and thank you for all that you do for the children, not only of our region, but for the country as a whole. And thank you to the board, Donna, and your amazing team for the leadership of PCCY. I would also like to reach out and say hello to Representative Jordan Harris. Jordan, you represent all that is great about the new, younger, creative leadership in our community, and we are all behind you. I would also like to thank my great friend, Senator Bob Casey, for his remarks. I fondly remember his father, Bob Casey Sr., who as governor signed House Bill 20 into law, creating Pennsylvania's children's health insurance program. I was proud to play a small role in the Casey administration, and it was an honor to support the work of such a dedicated group of public servants. That is part of why we are all here today, albeit virtually, to honor the incredible people who serve our youth. I'm thrilled to celebrate PCCY's health heroes, with whom you've given so much of yourselves and all of you over the past year. As a father of 5 and grandfather, I have become quite familiar with superheroes over my life. But the superheroes we are recognizing today prefer scrubs over spandex and lab coats over capes. The health heroes of PCCY use their superpowers to touch the lives of children and families each and every day. This past year, They rose to the challenge to help support our community when people needed help, compassion, and care. They are so much more than superheroes, and a single evening of recognition does not do them justice. For 4 decades, PCCY has been a pivotal voice for our children and an invaluable community asset to our region. I am consistently in awe of the work you do. It is an honor and a privilege to join you in your advocacy to support children across southeastern Pennsylvania and beyond. When I became CEO of Independence Blue Cross in 2010, I was fortunate to inherit a legacy of investing in our children's health and well-being. One of my predecessors, Fred DeBona, helped develop, as you had heard earlier, the Caring Foundation for Children. With the help of Steve Farah and others, insured hundreds of thousands of children across the Commonwealth. The foundation's success served as a model for Pennsylvania's CHIP program, which in turn served as the blueprint for the federal government's SCHIP program. Since then, SCHIP has helped millions of children around the nation. I believe that bipartisan public-private collaboration has spurred some of our nation's hallmark health initiatives, from Medicare to Medicaid and to SCHIP. The truth is that when we work together, we are at our best. The pandemic has tested our resolve, but as a region, we have come together to make an impact on the lives of our young ones. And I'm not just talking about civic, business, community, or public health leaders. Some of the most profound stories of this past year have come from neighbors helping neighbors and strangers looking out for others. Our Independence Blue Cross Foundation donated more than $4.5 million to community partners, including the PHL COVID-19 Fund. This fund provides grants to Greater Philadelphia nonprofits that support vulnerable populations. PCCY was one of those nonprofit organizations. Our region's willingness to support each other is a powerful expression of our unity and our connection. There's a reason they call us the city of brotherly love and sisterly affection. Philadelphians really care about each other. Healthcare is just that. It's care. We at Independence have always believed that healthcare is a right, not a privilege. And that right extends to our children, our most vulnerable too. From the get-go, PCCY has been a pivotal advocate to ensure all of our children get the services they need and deserve. A glimpse at PCCY's 40-year history is like looking at a laundry list of some of our region's biggest accomplishments to improve the lives of our children. From providing free vision care and dental care for kids in need, to helping and leading the way for expanding pre-K in Philadelphia, to publishing powerful reports that shape how we create policy. PCCY continues to give and give and give. As a city and a region, we owe so much to your efforts. We would not be who we are or where we are without you, PCCY. Which brings us to today. I was fortunate to transition the CEO role to an incredible leader in Greg Deavens. I know Greg will continue to be a staunch advocate for children's health. That includes partnering with PCCY. For 40 years, PCCY has been an invaluable public resource, and I cannot wait to see what they will accomplish in the next 40 years. Thank you for this honor, and thank you for our time together this evening.
Thanks so much, Dan, for those remarks. So gracious, so wonderful. Tonight we get to laud not just you for your great contributions. We get to welcome to our family the new president and CEO of IBC, Greg Deavens. Greg will be the first Black CEO of the enormous IBC enterprise, and in accepting the position, he said, "We will redouble our efforts to serve members and eradicate racial inequalities that exist in the delivery of healthcare and other aspects of our society." That's music to our ears. Thank you for taking the reins, and thank you for focusing on equity. Our kids need that. Greg, would you like to make some comments?
Absolutely. Thank you, John. I have so much admiration for you and your board, for Donna Cooper and her team, and for everyone that supports PCCY. It's certainly an honor to join you today. I also want to acknowledge the remarks that were made earlier by Senator Bob Casey and Representative Jordan Harris. It's really an honor to be on the same program with those two gentlemen. And of course, I get to follow my friend and mentor, Dan Hilferty, and to add to the richly deserved praise that he's received this evening. Dan, just like everyone else here, I'm inspired by you, and I'm grateful for everything you've done for the citizens of Greater Philadelphia and for others across the nation. Congratulations. For 25 years, Dan has been a private sector CEO with the heart and soul of a public servant. That's a great combination for an effective leader in healthcare. It's one reason why I decided to join Independence and work alongside Dan 4 years ago. And I've tried to adopt the same mindset as I succeeded Dan in guiding this organization. Even as he stewarded a large and successful family of companies and built a national profile as an expert and leader in transforming healthcare, Dan made every decision based on what will help the most people. It's a simple formula, and it works. Starting with Dan, and before him, Joe Frick, and going all the way back to Fred DeBona, I'm fully aware of the inspiring and daunting lineage of leaders that I'm now a part of here at Independence. These are visionaries who changed how people think about healthcare just by doing what they know is right, rallying talented people to the cause and forging strong partnerships everywhere. Independence Blue Cross is proud to be the leading insurer in the CHIP program in the 5 Pennsylvania counties that we serve, with our Keystone HMO CHIP plan covering more than 18,000 young people currently. We work closely with the community organizations like PCCY to spread the awareness of CHIP. And as I said a moment ago, if you do the right thing and bring people together, the impact can be remarkable. Our company is keeping that in mind as we take a hard look at disparities in health outcomes based on race and economic status. We have made a commitment both locally and nationally with our colleagues in the Blue Cross Blue Shield Association to work to close the gaps so that, for example, nationally, Black mothers no longer face a 46% higher likelihood of delivery complications than white mothers. In the same spirit, PCCY has been a force for equity in our region for 40 years. CHIP serves as a shining example of that, and we're proud to work with PCCY to support them. I join all of you in commending the amazing community health heroes that we'll celebrate shortly. And finally, let me once again congratulate and thank my friend, Dan Hilferty. What a great legacy you created at Independence and in Philadelphia. I'm honored to carry it forward. Thank you.
Dan and Greg are two of the heroes we gather tonight to honor. Thank you again for all you do and will do to make the lives of our kids better. For those of you just learning about PCCY this evening, it's not a PCCY party if there's no young person singing to us, reciting poetry, or showing us the breadth of their talent. Tonight, we are so honored that Callum Clark is willing to share their amazing voice with us. Callum is a senior at Upper Darby High School.
off-Broadway musical called The Little Dancer. I've also done a few local projects. I've been in The Wizard of Oz, Footloose, and most recently The Addams Family, where I'm Alice. Be sure to check us out. I'm a member of the Summer Stage Shooting Stars and of Upper Darby's choir and encores, and I am so honored to be able to perform this song for all of the heroes who have supported us. Thank you.
Survive when you feel like hope is gone. Look inside you and be strong, and you'll finally see the truth that a hero rising. Oh, Lord knows dreams are hard to follow, but don't let anyone take them away. Hold on, there will be tomorrow. In time, you'll find a way. And then a hero comes along with the strength to carry on, and you cast your fears aside, and you know you can survive. So when you feel like hope is gone, look inside you and be strong, and you'll finally see the truth that a hero rising. That a hero rising.
Hi, I'm Shelley Yanoff. For those of you who don't know me, I was the executive director of PCCY for 30 years, and it's such an honor to be here this evening. One of the things about anniversaries is that they cause you to reflect on how you got to where you are, and in the best of cases, they also cause you to think about where you're going. When PCCY was just a kernel of an idea in 1980, Wilbur Hobbs was there. As a social worker and then state official, he played a key role in a founding board member of PCCY. Now, as PCCY enters its next stage of impact, Dr. Lynn Starr, Wilbur's niece, who I'm sure heard many of our early war stories, is here tonight and on the board. Before I turn it over to Lynn, I just want to say that PCCY worked so hard on CHIP, and we were so excited to make healthcare for children accessible for all kids in this state. And that wasn't true before we got there and pushed real hard. So we are very happy to be a friend for kids and to carry on that great legacy, which Lynn Starr, Wilbur's niece, Wilbur was very fundamental in directing and in pushing us to do more and do more. And it's very exciting that his niece is here to pick up that missing piece that Wilbur's absence has caused, and now she is here. So I'm delighted that Lynn Starr, Wilbur's niece, will be a part of us from now on. She's carrying that great legacy of being a friend to kids.
Thank you so much, Shelley. It was such an honor to join the board, and I've been so inspired by this evening. It's really been wonderful, and I hope you agree. We're close to the end of our program, and no PCCY celebration ends before we thank the unsung heroes who make the lives of children better every day in our community. Of course, this year there have been many, including the Black Doctors Consortium, where many PCCY supporters have volunteered regularly, and the frontline health professionals like our own board members, Dr. Renee Tershi, Kathleen Noonan, and donors like Dr. Janet Haas, doing all they can to stem the tide of death caused by COVID. We are emailing you right now to tell you about 8 other health heroes who this year made sure children were safe and cared for. They are Dr. Cursa Barlow, an angel who works for the Chester County Intermediate Unit, who during the pandemic made sure the thousands of immigrant families in her county could get the health care they needed. Dr. Jay Goldsliker has one of the biggest hearts in town, and we know this because he's a member of our Give Kids a Smile family, and this year he went above and beyond to help us extend free dental care to children during the shutdown. Dr. Tawana Jones Morrison is one of the most creative school psychologists you'll ever meet. We are so grateful that she did not let the pandemic stop her work to deliver education about sexuality and pregnancy prevention to teenage girls. Katie Kenyon of the Foundation for Delaware County worked tirelessly to close gaps in healthcare access during the pandemic for some of Delaware County's most fragile families. We don't think that Rachel Loper of Mighty Writers actually slept for the first few months of the shutdown because she made it her priority to ensure families had what they needed, from food to medicine to diapers. Mary Nixon, the operations manager for Yeadon Borough, is our new best friend. She's responded to our call to end childhood lead poisoning by relentlessly using the powers of her local housing code to get the lead out of homes. Community Lead Services, Mary Pat Pileggi, is one of our state's unknown treasures. She leaves no stone unturned to find a way to make sure every child, including those who are immigrants, get the health care they need and deserve. And finally, our thanks go out to Lindsay Walker, a former PCCY intern extraordinaire and regular volunteer for Give Kids Site Day, which this year, with her help, went virtual. Please join me in giving these health heroes our appreciation. I'd like to turn it over to Lindsay, I believe.
Good evening. It's a pleasure to be here, and I just want to say thank you to everyone. It's just a bummer not to be in person. The PCCY parties are the best parties. So next year, everyone who's on here who's new to PCCY, absolutely make sure that you get your tickets. But I will say that this has just been an extraordinary night listening to all of the work that PCCY has been doing over the last 40 years, and particularly around healthcare for children. And I'm honored to spend a little bit of time talking to you this evening. And to give you a little bit of background about me, I am a social worker who actually started in my second year of social work school at PCCY as an intern. And it's been 15 years that I've been a part of PCCY in one way or another. It's been incredible. And at 15 years now, I am the COO of a large social service agency, Episcopal Community Services. And as I think about the work of PCCY and the impact that it has had, I just want to kind of zero in on what this year has been like for the provider community, particularly the child serving provider community. It has been extraordinarily difficult. I think people hate the word pivot, but I will say that child serving organizations have had to pivot over and over and over again as we've been working so hard to safely meet the needs of children and families during this last year. And what I think has kept us sane is organizations like PCCY and Donna and Colleen and Tomia and all the rest of the team who we can pick up the phone and call and say, we need to get some of the services together. We need to get to the table. We need to figure something out. It's not working for the kids. And we don't feel like our voices are being heard, and the kids are suffering. The families need us, and we don't have the same access that we used to have. And I don't know how the PCCY team has slept, but they have been extraordinary. They've been not only putting out the reports and doing the convening work that they normally do, but they have been rallying the troops, getting everyone on Zoom calls, identifying where the gaps are to really make this year, as difficult as it is, easier for children and easier for those of us who are on the front line serving children and families during these extraordinarily difficult times. So I'm not sure that you're seeing it. I don't, okay, here we go. Thank you, Delilah. So given all of that, I know that many of you have supported PCCY in the past. And I know that you have probably bought tickets to tonight's event. I am going to ask you to dig a little bit deeper. And I'm going to ask you to really think about how your year has been and the challenges that you have faced. And I want to tell you as a provider that PCCY has gone above and beyond to take care of kids and their families during this incredibly difficult year. And if you are able to, we would love for you to support PCCY right now a little bit more. In particular, we've been talking about CHIP all night, and we've been talking about the extraordinary efforts to get children covered. I will tell you that there are 24,000 children in Pennsylvania who are still not covered by health insurance because they are undocumented children. And if we have learned nothing from this year, we have learned how important it is to have healthcare coverage, and how critical that is for children from a health and safety standpoint, not just for those 24,000 children, but for all of us. We now know what herd immunity means. We now know that we are trying to get to that. Every child needs healthcare coverage in order for all of our children to be safe. And so the Dream Care Act that PCCY has been working on for the last 5 years is so close to being passed, and we need you to help us push that over the finish line. We're hoping to raise $10,000 tonight. So as you can see on your screen, there are several different ways to donate. You can click on the donate button. If you are having any trouble, let us know. We can try to troubleshoot with you, but this is what we need. We need to close the gap, and PCCY is an organization that has always been able to identify those gaps and close them. And we are so close to having all children in Pennsylvania covered with health insurance. And we know now how important that is. And I just want to share a little bit of a story, a personal story for me, and as I was thinking about this, I have 2 boys, and I have had to make some hard decisions for them this year. And one of the decisions that I made, and I'm sorry to all the angel dentists who are listening, is I did not take them for their 6-month appointment. So they have not been to the dentist in the last year. I didn't like to make that decision, but I felt, given COVID, that it was the best decision that I could make for my family and for my kids at the time. But as I think about how I felt okay making that decision, it was because my children have had health care all their lives. They've been to the dentist since then they were babies, before they even had teeth coming in. We're in a position where we can feed them healthy vegetables and fruits, and where I can get them toothbrushes so they can actually brush their teeth if I remind them over and over again. And that privilege, that extraordinary privilege of being able to make what is a hard decision as a parent, but knowing that your child has all of these protective factors in place, in particular because we've had health insurance, every parent should have that. Every parent should have that peace of mind. And the fact that we have too many families out there who are already stressed, dealing with the day-to-days of life, and that your children do not have health insurance. I mean, you've heard it. You heard from Representative Representative Harris, how important that was for him growing up. And I just want to share a couple of stories that I got from the PCCY team. So I told you about 24,000 undocumented children. Give Kids Smile Day this year was able to take care of 2 undocumented children. These kids had cavities, they had abscesses in their mouths, you name it. These kids were in extraordinary pain. Can you imagine as a child trying to learn virtually or in person and having pain in your mouth constantly? You can't learn, you can't focus. And I can only imagine what those parents felt, because they knew they wanted to get their children health care. They knew they needed to take them to the dentist, and they couldn't. And it's an organization like PCCY and all of the angel dentists out there and all of the volunteers and the supporters like all of you who made it possible for these children to get their mouths fixed. And they essentially had to rebuild some of their mouths because they were in such dire shape. No child should ever experience that kind of pain, and no parent should ever have to be in that position where they can't support their child. So if you can understand that as a parent, grandparent, uncle, aunt, just take a moment and think about how 24,000 children and their families today do not have the health insurance and what stress that puts on them. Please help us. I'm seeing money come in, 260 raised so far. I know it takes a little while to get to the donate button or to find your credit card. Who knows where it is in your house? But please, this is something that is extraordinarily important. We can close this gap. We can do this work. The PCCY team has been spending 5 years doing this effort. They are going to push this over the finish line with your help and your efforts. Thank you so much. It has been such a pleasure talking at you. I would love to see you all in person. I have been just incredibly proud to be a part of this organization. And a shout out to Javier, who started us all. He and I have been really thinking about the next 40 years of PCCY, and we have been working on the Young Professionals Advisory Council. And I want to tell you how incredible the talent is in that group of young people. So we're going to be in good shape for the next 40 years. And we hope that with supporters like you, advocates like you, volunteers like you, we can do much more. We can do amazing things like CHIP. As Representative Harris said, what's the next transformational change? I can tell you tonight, Dream Care is one of those. We can make it happen with your help. Thank you. Thank you so much. Let's keep the monies coming in, folks. Appreciate it.
Thank you, Lindsay. And right now, I'm on my phone making my donation. I hope that I'll be joined by all of those who are out there watching us today, because money spent on PCCY is money well spent. Another standard of any PCCY event is hearing from their great executive director, Donna Cooper. She's not only a champion for kids, I am proud to call her my friend. It's been my honor to be tonight's MC. Now, take it away, Donna.
Thank you, Lorraine. You fill my heart. This entire event fills my heart. I'm so proud of the work that we've all done together. And I just want to begin by saying how grateful I am that Greg Deavens and Dan Hilferty were with us tonight, and that we were able to give Dan and Greg and Independence Blue Cross our coveted Public Citizen of the Year award for 2020 and 2021. So thank you so much for being here. You've made children healthier, and it wouldn't have happened without the great work of Independence Blue Cross. And there's a lot more we have to do together. I'm the closer for this evening, so I want to let you know that while you're donating tonight, when you do, you're topping off our event. We hope to raise $225,000 tonight. We're only a few $1,000s short of our goal. So as you are typing in your credit card and your expiration date and your CCV code, please help us get over the top to that $225,000, because it makes the work that Lindsay talked to you happen. Now, also, I want to thank Callum, who sang from Upper Darby. And many of you know PCCY has long been a leading advocate for arts in our schools, and that work has to continue. And we're so lucky that there's so much talent among our students. Callum is just but one example of the talent among our midst, and our work to make sure there is greater arts access in the schools will not die. I also want to tell you that no PCCY event happens not only without a kid showing their talent, or a few, we're in person, but asking you to take action tonight. And so you're going to get an email while I'm talking to you, and in that email, we're going to ask you to help us with two things. In Philadelphia, we have a set of courageous city council members who are advancing a bill to protect children who, when they are living in institutional facilities, because they don't have a foster home, because they may need behavioral health services, or because they may be in the juvenile justice system. When they're living in those institutions, it's our obligation to make sure they are safe. And I don't need to tell you, as you read the Inquirer and you read the stories of what happened at Devereaux and Wordsworth and Glen Mills and others, that our children are not safe enough. Philadelphia City Council is stepping up, and they are poised to pass a bill that will create an independent office to investigate when children call for help. So we want to invite you tonight, if you live in Philadelphia, to send a thank you letter to City Council and ask them to let them know they have your support for passing this bill to keep children safe when they are unfortunately or need to be institutionalized. Those children depend on us, and City Council is going to depend on hearing from you. The second thing is that Lindsay talked to you, and so did most of the speakers tonight, about the work we must do to close the last health insurance gap in Pennsylvania, and that is to extend healthcare coverage to undocumented children. 7 other states do this already. 3 Republican governors have done it. And guess what? The state of Rhode Island is debating it right now. I want Pennsylvania to pass Rhode Island and get this done first. I'm assuming you do too. So the second part of your email tonight includes a letter that you can send to your state lawmakers, and it encourages them to make it a priority to close that healthcare gap for children in Pennsylvania before they leave for the summer once they pass the state budget. So you can take action tonight. It's like the letter that Kathleen Johnson said in the beginning of her video. She never thought that one letter would make a difference. And look, it made a world of difference for children. So we invite you to send your letter tonight. I want to thank you very much. Thank you for being with us this evening. Stay healthy and stay with us in this fight. And we together will put children first. As we close, I want to tell you that this is the only party in PCCY where anyone's ever been able to hear the program. And that's because we're not in person and everybody isn't talking the whole time. But we know you want to talk to each other. So we're going to organize some breakout rooms right now. And you can kibitz and gossip and compare notes and figure out all our flubs and all that kind of stuff. We wish we could be here having hors d'oeuvres and wine and beer with you, but hang out and talk. Have some fun for a few minutes. If you haven't eaten your cookies, share them then. Thank you so much for coming tonight. We are so grateful you spent your evening with us. And please stay around to talk with your friends at PCCY. Good night, folks.